Hello everyone and welcome back to my channel. If you walk into a cabin, shed, or garage and smell something musty or see rodent droppings, stop right there because you might be walking into something that can potentially be deadly and can cause serious pulmonary issues, and that is the Hantavirus syndrome. Here's what you need to know and can help protect yourself. Hantavirus is normally carried through rodents such as mice in the United States, and the disease can be deadly and it causes a respiratory illness that is known as the hantavirus pulmonary syndrome. Although this disease is rare, and it doesn't transfer from human to human. But let's take a look at some important facts about the hantavirus. So as stated, it is rare and it doesn't transfer from human to human. But let's talk about the one that is transferred from human to human, which is what we're seeing now. And that is known as the Andes hantavirus. Most infections happen when people breathe in virus particles from things like rodent urine, droppings, saliva, or dust contaminated with these materials. This often happens when someone sweeps or disturbs an enclosed space like a shed, cabin, or garage. Less commonly, it can happen from rodent bites, but that's rare. The key risk is this: disturbing contaminated dust in a closed or poorly ventilated space. On the screen, I'm showing different types of rodent droppings. That way you'll be able to identify what they are before disturbing them when cleaning up a mess. However, Andes virus is unique because it can also spread person to person, typically via close contact, such as respiratory droplets or intimate contact. Researchers think Andes virus is able to spread person to person because of a combination of higher viral levels in human secretions, its interaction with human cells, and where the virus replicates in the body. The exact mechanism is still being studied, but several factors stand out. Early symptoms can feel like the flu. Things like fever, fatigue, muscle aches, headaches, chills, nausea are just some of the symptoms for hantavirus. However, in some cases, it can quickly make a turn for the worse. Things like shortness of breath, fluid in the lungs, severe coughing. This is when it becomes life-threatening and it's time to seek help. How to avoid the hantavirus? The good news is there's precautions that you can take that will dramatically reduce your risk. Number one, never vacuum or sweep rodents dropping dry. Instead, what you want to do first is wear some gloves. Next, spray any droppings that you find with a disinfectant spray or some Clorox bleach. Let it soak for 5 to 10 minutes. Then you want to take a paper towel, still with your gloves on, and pick up the rodent droppings. Number two would be ventilation. You want to make sure when you entering into a shed or a cabin, you open the doors, the windows, and let it air out for about 30 minutes before entering. What this does is it helps to keep the particles down and it helps to ventilate the area. Number three, prevent rodents from entering your home. Simple prevention goes a long way. Seal cracks and holes, store food in sealed containers, Clean up crumbs and trash quickly. Less rodents equal much lower risk. Number 4, be extra careful in high-risk places, such as cabins, barns, sheds, storage units, garages. Always assume rodent contamination is possible and clean safely. Now let's compare this to the Andes virus. Now let's compare the hantavirus that is spread from rodent to human in comparison to the human-to-human contact. One major reason may be the extremely high viral load in infected people that carried the Andes hantavirus. Patients with Andes virus can carry large amounts of the virus in their bloodstream, saliva, and respiratory secretions. That means close contacts may inhale infectious droplets or come into contact with contaminated fluids. By comparison, viruses like Sin-Nombre virus usually don't reach the same levels in areas that support human-to-human spread. Next is the lung and blood vessel infection. Andes virus is also highly effective at infecting lung tissue and endothelial cells, which is the cells lining blood vessels. The virus can replicate aggressively, weaken vascular barriers, and survive long enough in respiratory secretion to infect another person. This damage contributes to the dangerous lung leakage seen in hantavirus pulmonary syndrome. Next, we have the close contact transmission. Even so, Andes virus is not highly contagious like COVID-19 or measles. Most documented transmission happen during household exposure, as discussed earlier, caregiving, kissing, or intimate contact, or prolonged close proximity during early illness. Scientists have not observed large-scale airborne community spread. And finally, there are genetic differences. Researchers also believe genetic differences in the virus surface protein called glycoproteins may help Andes virus. First, bind to the human cells more efficiently. 2, evade early immune defenses. 3, remain infectious between humans. But this is still an active area of virology research. Hantavirus is rare but serious. And the key point to remember is this: it's not spread person to person in everyday settings. It's spread through exposure to rodent contamination, especially when disturbed. So the real protection is simple. Be careful, clean safely, and avoid kicking up contaminated dust. So there you have it. If you found this video helpful, please don't forget to hit like, share, and subscribe for more health and safety breakdown that actually makes sense. Thank you. Have a great day.